KNON 89.3 FM in Dallas and Fort Worth, the voice of the people.
Business owners, tell KNON's listeners about your business. You can put your business or event on KNON. KNON currently has space available to run announcements for you. Tell KNON's listeners about your goods, services, nightclub, concert, or event. Help keep the voice of the people on the air while putting your information on the air. KNON's been named the #1 radio station in Dallas by both the Dallas Observer and D Magazine. Put your business with Dallas's #1 station. Call now for more information at 214-828-9500, extension 227, or extension 233. For more information, go to KNON.org and click on the Run Spots on KNON page. It's a great way for your business to support community radio while letting more people know about you.
All right. Hello, everyone. This is Workers Beat, and this is Kenneth Williams and Ken Stevens. We're filling in for Gene Lance, who is not available today, and we've got a lot of stuff to talk about today, and so we're gonna start and get to it. One of the things I want to do today is to do some follow-up on the Trans-Pacific Partnership. The Trans-Pacific Partnership is being snuck, and I want to emphasize they're kind of trying to sneak it through the legislative process right now with something called fast track, by which this very important piece of legislation would go through without congressional oversight or investigation. And what this agreement is, it's a kind of NAFTA-style agreement, a NAFTA on steroids. And what it would do is it will have a big impact on whether or not we have jobs in this country or whether they get shipped overseas, whether there's regulation of the financial industry or not, whether or not our health care, our pharmaceuticals are affordable, or whether or not they're based on what's ever best for the pharmaceutical companies. These are the kind of impacts this is going to have, and they're trying to sneak this through the Congress right now, and it's something we want to be aware of. And hello, Ken.
Hello, Ken.
Sure. Okay. Well, that sounds okay. But that just happens to be both of our names. So we'll just try to keep track of who's who at any particular time. Now, in my focus on the Trans-Pacific Partnership, one of the reasons why I wanted to bring that up is because President Obama is going to have a State of the Union this week. And in his State of the Union, he's expected to talk about economic inequality. Now, economic inequality is one of the things that is, of course, very important to all of us right now. And we definitely support many of the things that the president wants to do about economic inequality, such as raising the minimum wage, such as extending the job benefits. So these kind of things are good things to try to help people who are in the lower end of the economic ladder right now. But at the same time, President Obama is pushing the Trans-Pacific Partnership. And what I would say to him, and what I would say to any Democrats that are supporting this, or to anyone who's supporting it who's concerned about economic inequality, is that this is a real contradiction. Because on the one hand, if you want to reduce economic inequality, you have to help working families and improve their prospects for making a living. But that's the opposite of what the TPP does, because the TPP, like NAFTA, will have the tendency to ship more jobs overseas. American workers can't be expected to compete with people in Vietnam who are going to work for 75 cents an hour. That's not how you're going to help reduce economic inequality. So to the degree that the president supports this policy, this is going to really affect us.
Want to go to line 3?
And in line 3, we have Randy.
All right, he's up.
Hello, Randy.
Good morning, you guys. How y'all doing?
Doing great.
First, I didn't get on the line to the last show, and I want to send out my condolences to Brother Barnett and his family.
Well, thank you very much.
Secondly, Mr. Petrie's issue was more important than the job line on the last show, and the job line has been on KNON for almost 4 years, every week. So I'm pretty sure Greg's still listening, and I'm hoping you guys will allow Greg to call back and take a few minutes of your show to put the job line on KNON, because I know it supplies people with good paying jobs and brings the workforce around. So that's my question to you, and I'll hang up, listen to your show.
Okay, well, thank you, Randy.
Thank you, Randy.
Yeah, so when we look at the history of what happened with NAFTA, after NAFTA was passed, and this is the 20th anniversary of NAFTA, there were 5 million manufacturing jobs that were left the United States since NAFTA was instituted. And when we look in the middle of America now, what used to be our industrial heartland, where we had very many good factory jobs of steel workers, of other kind of manufacturers, these jobs have now left the United States, and we now call that part of the country the Rust Belt. TPP has the potential to do more of the same, which is why we definitely need to oppose it. We need to let President Obama know, we need to let any representative we have, whatever party, that this is not something that is going to help American working families at this time. The TPP is a threat to the economic security of ordinary American families, and you can't be credible in saying you want to reduce economic inequality and support the TPP. These are flat-out contradictions. We've had flat wages since the 1970s, in part because of NAFTA. We even have service jobs. A lot of times people will say, well, you just need to get an education in order to reduce economic inequality. Well, we have jobs in engineering. We have call center jobs where people have degrees in computer science, where these jobs have also left the country. So it's not a simple matter of, well, if folks just get an education, they'll be okay. It's not going to be that simple if you arrange these agreements so that it's all in favor of those who make a living through capital, and there's no concern for the people who need to get a job.
Is Vietnam the only country involved in the Trans-Pacific Partnership?
Some of the countries that are involved, it's not the only country. We have Malaysia is involved, Australia, Canada, Mexico. There's quite a number of countries that are involved. And one thing about this agreement is that when countries sign on to it, when they get added to it, they're agreeing to follow all the provisions that have already been passed in it. And once these provisions are passed, they can't be changed unless all of the countries agree to it. So this could lock us into a number of things which are pretty bad for us going down the line. Let me give you a couple of examples. There's food safety. We would have to import food, in some cases made in underdeveloped countries that don't use the same kind of food standards that we use in this country. And what they want to do is they want to make sure that the companies won't be required to put a label on the food to tell you what countries it's from. So you would go in the grocery store and you don't know if that food was manufactured in Texas or California, or if it was manufactured in Vietnam or Malaysia. And so you would have to essentially just take your chances.
So the FDA wouldn't have any oversight in this?
The FDA, and that's a good point, local regulations are going to be subordinate to what they agree in the TPP. The TPP will trump what we pass in our state laws, what we pass in U.S. federal laws. And if there's a dispute, the dispute does not go to our state courts or our federal courts. They will go to an international foreign tribunal made up of people who are outside of our political process, who represent these corporations, and they'll decide. And we would, as taxpayers, could end up paying and will end up paying billions of dollars in these kind of judgments that come out of these international tribunals. So I think if you're a person, I know some of our friends on the political right were afraid when the American for Disabilities Act, when the United Nations wanted to kind of adopt that and promote that as an international standard based on our own Americans for Disability Act, and it was supported by Senator Bob Dole. They opposed that because they thought, well, that will kind of subvert American law. Well, that was mostly not correct. That was mostly a delusion. It really wouldn't change American law. This will in a big way subvert American law, because there's a whole set of international tribunals and a whole set of rules that will trump our own domestic law.
So can we possibly have the states exclude any of this, or the states have no authority to override any of these regulations?
If this gets passed, states will not be able to override it. The federal government won't be able to override it. Our courts won't be able to override it. The only way it would be overridden at that point is if we completely withdrew from the TPP, which would be difficult and will probably generate lots of, say, lawsuits and liabilities because we have violated this agreement that we've signed into.
I see. How about Congress? You say, is Congress not giving enough oversight to this?
Well, Congress is supposed to provide oversight for trade agreements, but what they're trying to use is something called fast track. Fast track is something that bypasses most congressional oversight. It, for example, limits the debate to 20 hours. It doesn't allow for the kind of congressional committees that would provide testimony and input from the public. It bypasses all of that and allows the president to quickly push the agreement through. And so fast track isn't something necessary in order to get a trade agreement. It's something they've used rarely in the passage of trade agreements. But this thing has such bad stuff in it, or potentially has such bad stuff in it, that they want to push it through quickly. That's why most of this agreement has been negotiated in secret. Our congressional representatives haven't been allowed to see all the provisions of the TPP. Who gets to see the provisions of the TPP? Well, representatives from international corporations get to see it. The public doesn't get to see it. Our elected representatives don't get to see it. They don't want to share it with the media so that everyone can see it. The people who get to see it are the insiders inside of really big corporations.
Is there a special congressional committee that's supposed to be handling this situation, or is it something different that's being done?
Well, I'm not sure of the particular committee, and there is a particular committee in both the House and the Senate that handles these agreements, but I can't call out the name of that particular committee. But there is a particular committee. There is a resistance to having this agreement go through, particularly having to go through under fast track, and something I believe about 170 Democrats in the House have signed on to resist that agreement, and a number of Republicans as well.
How about President Obama? What's his official position?
President Obama's official position is he's supporting this under the theory that it promotes free trade. But this agreement doesn't have that much to do with free trade so much as it has to do with enabling corporations to have a lot more control over international trade. For example, if you talk about the World Trade Organization, under their rules, it takes a government to challenge an agreement that's a provision of the World Trade Agreement. Under the TPP, any corporation can challenge either the federal government or a state government or any government in the world if they think their interests are challenged, and then they could sue and retrieve lots of money, lots of taxpayers' money based on this agreement, which, again, most of the people haven't really seen and don't have any input into.
Sounds like the corporations have their lobbyists.
Yes, this agreement is being driven by the corporation and their lobbyists. Now, I want to tell you about an action that's planned in the near future to resist the TPP. This is an action that's been called by Jobs with Justice, and also MoveOn.org is also supporting this. And it's going to be on Friday, January 31st. It will be over by 2012 North Hollis Street. This is near Clyde Warren Park. there's going to be a rally there to resist the TPP.
Okay, we'll write that down. So, Vietnam, I've been hearing that they have some pretty cheap labor over there as far as their wages being really down.
Yeah, it's about 75 cents an hour. And also, the Vietnamese workers don't have a right to organize, or they don't have a lot of input into their working conditions. And so this would be an easy place if someone wants to just cut labor costs, to ship work there. But of course, that will be at the expense of workers in America and in other advanced countries where workers have more rights. And it will also be exploitative of the workers in Vietnam. So I could see if they were going to say, hey, we're going to give them good working conditions and good pay over there. But no, it's basically a way of exploiting them, and at the same time, it will deprive American workers of jobs.
How about how about government tariffs? Are they going to be bypassed?
Well, the whole idea of what they're doing in the TPP is basically undermining the rights of workers in advanced countries and exploiting the labor of workers in countries that are less developed. So tariffs would be something, and again, I don't know what the degree of tariffs would be within this particular law, but it's the opposite of what they want to do. They want to pretty much not have tariffs so that they can pretty much move the money anywhere in the world they want. Okay, we will be right back. Okay, this is Workers Beat, and we have Ken Stevens here, and I'm Kenneth Williams, filling in for Gene Lance. Okay, on the Trans-Pacific Partnership, this is the agreement where essentially the whole rules of our law are going to be subverted by agreement which is going to let corporations set the rules. And it's an agreement which is being negotiated largely in secret, and they're trying to jam it through using something called fast track. And this is something we really want to be aware of because it's going to have a big impact on all of us in terms of jobs being available, in terms of food safety, in terms of pharmaceuticals. The TPP, we know, for example, that in Canada they have cheaper pharmaceuticals than we have here in America. Under the TPP, they may force the Canadians to pay the same high prices for pharmaceuticals that we pay here in America, or perhaps even higher prices for both us and the Canadians. This is the kind of thing they're trying to jam through. And as I was saying before, this is going to reduce the standard of living of American working families. In other words, it's going to increase economic inequality, and it's something that the president and other Democrats who have begun to finally address the issue of economic inequality, they have to be real careful that they don't simply counterfeit their own attempt to change the focus of the argument by supporting something like the TPP. The TPP undermines any attempt to fix the problem of economic inequality. It makes that problem worse. And so they really ought to think about that before they go forth and try to support the TPP. I want to salute the Democrats who are opposing the TPP. Some of our local congressmen who have already signed on to oppose the TPP include Congressman Mark Vesey, and also Eddie Bernice Johnson is also on record as opposing the TPP, and I salute them for their opposition to it. Now, I want to turn to another issue, and this other issue is something that, speaking in terms of economic inequality and also here in the great state of Texas, is the Medicaid expansion under the Affordable Care Act. As you know, the Affordable Care Act is now the law of the land, and it's being rolled out, and people are signing on the exchanges. And in some states, people are also getting the advantage of using Medicaid who've never had that opportunity before. Not so in Texas. Now, the Medicaid expansion would make Medicaid available to people who make up to 138% of the poverty level. And what that is for a single person, that's basically $15,850 a year. And what that translates to, if you were a full-time worker, that means you would be making about $7.62 an hour. Okay, so it's really low wages that they're providing this Medicaid to. Now, the state of Texas has decided to oppose that. And by doing so, this is denying Medicaid access to about 1 million people in Texas. These are people, and these are, when conservatives say they oppose these kind of programs, they say, well, you know, we don't want to take care of lazy people, right?
Yeah,
they say that sort of thing. These people are working. They're working, they get up every day and they go to work, and they're being denied access to health care because they're poor. And here's what makes it even crazier. The money for this health care has already been allocated under the Affordable Care Act. The federal government pays 100% of the Medicaid costs this year and the next 2 years. For the first 3 years, the federal government pays 100%. After that, the state of Texas would pay 10%. Despite all that funding that's already available, that we've already paid for, they are denying health care to at least 1 million people in the state of Texas. Now, why would you do that? Why would you do that? What sense does that make? You got an opinion, Ken?
Yes. Why would they want to deny that? Are they getting some kind of a kickback or something for not accepting the program, or?
No. See, that would make a little bit of sense. Then I would say they're mean, but not stupid. But what they're doing is they are actually leaving money on the table. The state of Texas would get about $9.2 billion into its economy if they took the Medicaid expansion, $9.2 billion. So what we have here is you have an arbitrary withholding of health care services. And when you withhold health care services from people, this is what it really means. It means that a person who might have diabetes, they might have high blood pressure, they might have cancer, this won't go diagnosed for months, maybe years, until they get so sick that they need to go to the emergency room. Then they'll find out that they're really sick. But by then, they now have a life-threatening situation. Something that could have been treated had they gone to a doctor and had they had the opportunity to have a checkup and get some kind of control of that condition that could have saved their lives. That won't happen because Governor Rick Perry has decided, well, I just don't want these poor people to have health care. It won't cost the state of Texas any more money, right? Because you're already paying for this. You paid for that money that's available. You paid for it in your taxes. So it won't cost you any more money. And you're going to also cause these people pain, possible suffering, in some cases the loss of their lives. And why are you doing it? You're doing it because of politics. You're doing it because you just want to say, hey, let these people suffer because they're poor. Their income is below a certain level, so I don't want the government to give them any health care or any help. I'd rather have them get sick and not have any help or even die. Now, what happens when you don't get health care until you get to the emergency room? That's the most expensive place to get health care. And when that happens, when those people go to the emergency room, which some of them will, you're going to pay for it anyway. Those of you who have health insurance, that money is going to be passed on to you and your premium. You're going to end up having to pay more. So you pay the taxes for the Affordable Care Act already. You are helping people get health care in California or New York or someplace like that. You're not helping them here in Texas where you live. And you're going to end up paying more when they go to the emergency room. So why is this right? Why is that a good public policy?
Well, does Governor Perry have a policy of his own that he wants to implement?
Yeah, his policy is you don't get health care in Texas if you're poor. That's his policy. That is his policy. That's his policy. And the guy and the Republican who wants to replace him, Greg Abbott, has the same policy. If you're poor in Texas, you shouldn't get health care. You should suffer. Even if it's not really going to cost Texans any additional money, it's like they just because it's like it's in their minds it's a kind of a twisted principle. If it's a principle, they want the poor to suffer not having access to health care just because. You can't make an economic argument for it because they're leaving $9.2 billion on the table. So you can't make an economic argument for it, and you can't make a moral argument for it, because why in a wealthy state like Texas, in a wealthy country like the United States, should people be deprived health care because they're poor? Why is that a good idea?
Well, that's a good question. I'd like to know what the Democrats in Texas are saying about it.
Well, the Democrats in Texas do want the Medicaid expansion fund, so that is something that the Democrats would do differently if more of them, if they were in control of the legislature and the governor's mansion. That would be a different policy. In fact, if you look across the country, the states that are withholding access to health care to poor people are based on the Affordable Care Act, are all states run by Republicans. There are no states with a Democratic legislature and a Democratic governor that are rejecting the Medicaid funds. All of these states are run by Republicans.
Don't you find that some Republicans actually use these programs?
Oh, absolutely. And I think a lot of Republicans would support people getting access to this health care if they understand that this is a matter of right and wrong to me. You can't really come to me and say that it makes sense to put someone's health and life in jeopardy because their income is below a certain level. These are publicly available funds. These are things that have already been paid for by the taxpayer. Why wouldn't you let people have access? And I think a lot of Republicans understand that, and I think a lot of them would support it. I don't think the average person there is just mean enough that they really are sitting there saying, boy, I don't want these people to go to the doctor because they're poor. Because remember, there's often the justification for the cruelty to the poor has to do with, like they'll quote this passage of the Bible saying that if a man doesn't work, he shouldn't eat. Well, these are talking about people who work. They go to work every day. I mean, in order to be within the range that's of income that's affected by the Affordable Care Act, you have to have a job. You can't really get up to 138% of the poverty level without working. And so these are the folks who are really being affected by this blockage of health care services. It's not a matter of someone just sitting back and not trying to do anything for themselves. These are people who work for low wages. They're working for the minimum wage. They're working part-time. They're working for $8 an hour and $9 an hour. These are the people who are being affected by this. And why would you deny health care to the working poor? I would love to, somebody take the other side of that question.
I had a friend of mine in Tyler. He was talking to some people, and they were saying that they think that the benefits should be cut, but not their benefits.
Well, now that's interesting. Yeah, sometimes you have people who feel their own pain but can't feel anybody else's. So that's true of some people. They want their benefits, but your benefits should be cut. But the thing you got to understand is that one of the things that's happening in the economy now, particularly since the Great Recession, a lot of people who used to have good jobs are ending up with low-paying jobs. Because when the economy is coming back, as it's coming back slowly, a lot of good jobs are not returning, and we're getting a lot more low-paying jobs. So some of the people who used to be, quasi-middle class or whatever, are going to find themselves in these low-income jobs, and they're going to be the ones who are going to be denied health care under these kind of policies. It won't. I'm not saying it's going to happen to all of them, but I guarantee you it's going to happen to some of them.
Well, why is it? It seems like that the politicians have pretty good health care, and that they don't feel the pain of the ordinary workers.
Well, a disproportionate percentage of our politicians are pretty wealthy, and so they're completely unaffected by these kind of policies. But it's not even just the politicians. One of the things we have to look at why they do this in a state like Texas is you have to look at what happened in the last gubernatorial election in 2010. In that election, only 35% of the eligible voters voted. And Rick Perry got about 18% of those eligible voters, and the person running against him got about 17%. So essentially, you had only about 1 out of 3 eligible voters in the state participate in the process. So you got more people not voting than voted. And that's a problem in Texas in general. Texas has the lowest voter participation of any state in the country, the absolute lowest. So the reason why a politician like Rick Perry or Greg Abbott feels comfortable in denying health care to poor people is because he doesn't expect the poor people to retaliate by voting. He expects them to stay home. And that's their expectation. Many of these kind of policies would turn overnight if they understood that, you know, folks are going to remember that I did this and they're going to show up and vote. There's no strong passion out there for stopping people from getting health care. I don't believe that. You know, despite all the hysteria about Obamacare and all of that, if you understand this means that a specific family, they may have sick people in their family and they can't go to the doctor, most people don't want to sign up to be on that team. Let's keep them from going to the doctor. That's not what people want to do. So if a politician takes that stand, they're doing it because they don't think there's any consequence. Now, 2014 happens to be an election year. There's going to be a primary on March 4th, 2014. There's going to be a gubernatorial election for a new governor in November of this year. I think one of the priorities of people who are not content with the fact that people aren't getting health care in Texas, even though it's already been funded and made available, you have to register to vote. You have to vote. You have to. This is the only thing that's going to change these kind of policies. People who are affected by this directly need to vote. People who sympathize with these people need to vote. If we make this a frontline issue where politicians are going to have to be held accountable for it, this will turn around. There are other states that have Republican governors, some of whom initially made the same kind of arguments that Rick Perry is arguing about, how we can't afford it and it's too much trouble and all this kind of thing. And some of these people have changed those policies because they have local populations that have put pressure on them. John Kasich in Ohio, the governor of Arizona, whose name escapes me for the moment, but she also
Jan Brewer?
Jan Brewer, thank you. Jan Brewer, she took the Medicaid expansion. The state of Utah, and there are very few states, I don't know if there's any state in the United States more conservative than the state of Utah, just announced yesterday that they were going to do the Medicaid expansion. So this is something, because again, the whole logic of it, the moral case is solidly on giving people access to health care. The financial case is firmly on taking the Medicaid funds because the funds are available. You're already paying for them. So I think pressure will move this situation if we put pressure on them.
I see. So how would you answer somebody who would say to you that we don't want to pay for somebody else's health insurance? We only want to pay for our own.
Okay, that's an interesting belief. Now, here's one. What I would say to that person is you have to understand that in reality we all pay for other people's health care, even if you just have private insurance. Because in private insurance, you're paying some money to the insurer and somebody else is paying money for the insurer. Hopefully, most of the time, you don't get to use those benefits. To use the health care benefits means you're sick. You don't actually want to be sick. So you're throwing money in the pot as someone who has private insurance, and other people are, but the only people who are using the money at a given time are the people who are actually sick. And that's not, so what I'm saying is there are no healthcare systems where we are not sharing the costs of our illnesses unless you're somebody who's so rich that you just paid for it all out of your own pocket. And we will return to this in a minute. Okay, we're back. This is Ken Stevens, and I'm Kenneth Williams, and this is Workers Beat. Ken, you asked a good question about there are folks who say they just want to pay for their own health care. What's interesting about that is we're one of the few countries where people try to, quote unquote, just pay for their own health care. And so we have roughly, or at least before the implementation of the Affordable Care Act, we had about 15% of our population that was uninsured. Now, at the same time, we have a healthcare system where we pay nearly twice what they pay in other developed countries for health care. And let's see, we have a phone call. We have Joshua on line 2. Hello.
All right. There you go.
Hello, Joshua.
Good morning, Kenneth.
Hey, how are you doing?
I'm good, thank you. I wondered if I could contribute to the conversation about healthcare.
Oh, certainly. Please do.
Yeah, I think your colleague there, who I didn't catch his name.
Ken Stevens.
Ken, all right. There's 2 Kens in there, all right?
Yes.
Yes, sir.
Yeah, and he asked the question, what would you say to a person who said, well, I don't want to pay for another person's health care? And I think your answer was that, which makes sense, it's a kind of a practical thing. You're paying for it anyways, so why not go ahead and do that? I think another way, an additional way we could argue for helping to pay healthcare costs is that we do a lot of things collectively, right? As groups, we fund things like fire department, we fund safety things, police, military things, water, a lot of infrastructure projects. And in many parts of the world, it's assumed that healthcare should be one of those things that we fund together, collectively, as a group.
Yes.
So I think that's another argument that we can make with people who really don't want to pay for that. Say, well, maybe we should pay for it. Put it in these moral terms, that it's something we should do as a group.
Absolutely. Absolutely. I agree with you very strongly. In fact, this is actually the only industrialized democracy that does not have the concept of providing health care as a right. And I firmly agree with you, it is a right rather than something that is a privilege or something that you buy as a marketable good like you buy a sports car. It's a right. And every other industrialized democracy recognizes that and has a system in place where they provide health care to their whole population. That's the moral piece of it. Then the other part of that is cost. We, by trying to avoid covering everybody, pay more than everybody else, almost twice as much as everybody else, and we're just trying to avoid paying. But because of that attitude that I don't want to pay for the next guy's health care, you're paying twice what you would pay if you were willing to pay for the next guy's health care. And so go ahead.
Sorry.
No, you don't.
Yeah, I was going to say, too, that another argument I've heard, I've been back living in the States again the last just 3 or 4 years ago. Before that, I lived in England for almost 7 years. And one of the arguments I've heard is that, the national health systems are terrible. You've got people dying waiting for this or that. And you know what? I never saw any of that. When I lived in England, I never heard those kinds of stories about people dying waiting to get their tooth pulled or something like that.
Exactly. Those are anecdotes that they use to scare Americans into not having some kind of national health care system. In fact, if you look at the life expectancy numbers to compare America to other developed countries, we do not have anywhere close to having the highest life expectancy. We're kind of far down the pack compared to these terrible countries that have these national health care systems. So that's a boogeyman that they use to scare people.
Indeed.
Right.
Yeah, and I think the other thing too is they took care of a lot of people, regardless of citizenship and these kinds of things.
Exactly.
I had a friend who was another international person living there, and he had really serious health problems, and the system took care of him. That was part of the people's belief. Look, we're going to take care of people who live here.
Exactly.
I think it's a good thing that we should try to do here as well.
Joshua, let me ask you a question. How would you respond to someone who says that, well, we have all these illegal immigrants coming in here and using our facilities, and we have to pay for it? How would you answer somebody who says something like that?
Well, I think the first thing I would do would be say, well, I don't. I think that people should have the right to go and live and work where they want to live and work. So I guess I would first say, the idea of a legal immigrant is not the way I look at things, and not the way I think we should look at things. First of all, and I would say to them, look, these are other workers, right, like you, trying to make their lives better. So first, I would confront that issue, the idea that we should control immigration or control immigration. After that, I think it's really something that's debated by economists, right? What is the effect of immigration on the economy?
That's true. That is a thing that's hotly debated. One of the things I find interesting in that debate is that the same people that are afraid of having more workers come to this country from other nations will then say, when you shift to another argument, you talk about Social Security, they say we have to cut Social Security because we don't have enough workers paying into the system. So their arguments shift depending upon what we're talking about. So when it comes to immigration, we have too many people in the country. When it comes to Social Security, we don't have enough people, therefore we have to cut grandma's Social Security check. So they're very flexible in terms of how they make their arguments, but they're very inconsistent.
Yeah. So I think that's the way I'd address that, Ken. But Kenneth, I hope you all have a great morning. Thanks for taking over for Gene and Bolly for filling in. I guess they're down at the conference, right, in Austin?
Yes, right.
Yes, sir, at the conference.
Yeah, cool. Well, have a great morning. See y'all.
Okay, thanks, Joshua.
Good morning.
Bye-bye.
And we have Michael on line 4.
How y'all doing?
We're doing pretty good. How are you doing?
Yeah, the question I would answer them clowns talking about paying for somebody else's, health care. I wonder did their parents pay for them when they was born,
Oh, I'm sorry.
I wonder did they pay for their grandkids when their grandkids were born?
Well, in reality, nobody, like I was saying, nobody actually pays their own health care bill out their own pocket. Everyone pays a percentage, and that's all we're asking.
I don't see, I ain't never seen nobody writing a check when their kids was born at the hospital.
Well, if they did, they didn't write it for the entire amount. I tell you that.
And for the immigration, all these folks talking about these people coming over here illegal, give these Indians their country back. Then come to them and talk about illegal aliens.
Okay, you got deep there, my brother. Okay, I hear you. That's this is true. I don't think they're going to want to go there.
I'm talking about the white people.
Oh, I understood. I understood what you were saying.
All right, y'all take care.
Okay, now, thank you.
Thank you very much.
Yeah, and one other thing on that healthcare idea is that when we talk about healthcare, we keep talking about the benefits to people who don't have coverage and the poor and that sort of thing. But the Affordable Care Act also is a great benefit to people who are quote-unquote middle class, because one of the things that happens to a lot of middle class people when they lose their job and they lose their health care is they become bankrupt. And again, it's the only country where we see that phenomena. And if you have this law, you can protect people from bankruptcy. And right now we have another caller. We have Sam on line 2. Hello, Sam.
Yes.
Hello.
How's it going?
It's going pretty good.
Awesome. Calling here from Fort Worth. Just in response, I don't know if you guys are still on the horn talking about health care and illegal immigration and such.
Yes, we are.
But, it's funny. I speak to a lot of different people in different communities and different occupations. And the more I talk with people who are military, don't want to be off fighting wars. They want to be here protecting our borders. And that says a lot to me about, the necessity for our military's influence on our lives and what they want, because they're out risking their necks for us. And I think there is a problem with illegal immigration, especially on the local level and my city level, when I need to get health care for myself and I have to wait in line behind 50 other people that weren't born in this country. That's kind of a problem for me.
And if that's happening, like I said, if that's happening, I could see where you would see that as a problem. Now, myself, I have health insurance. I just have never gone to get in any kind of assistance on health care and seen a line of 50 other people who, quote unquote, aren't born here. So I'm not sure where you're going to get your health care. But like I said, I understand if that's what's happening to you, that would be a problem. I just have a hard time perceiving that the ability of an American to get an appointment to see the doctor is affected to any degree by people who are here illegally. I mean, don't get me wrong, we might go do the research and find out, yes, that's true, but I haven't seen it personally, and it's hard to conceive, and I'll tell you a couple of reasons. One, most people who are here illegally don't have health insurance. So how is it that they jump 50 of them at a time ahead of you in the line?
Medical Services for Indigents. It's a program out of Orange County, California, and it's a local healthcare service for anyone who's poor, and you get a reduced rate.
Oh, okay.
Well, I fit in that criteria for lower income, and I have nerve damage in my back, and I just wanted to get in to see a doctor. And every time I go in at 7 a.m. and wait in line in excruciating pain behind children with the sniffles and adults with the sniffles and colds, and basically just burning up spaces in line when there's people like myself that actually needed serious medical attention, and I couldn't get it because, I mean...
Sam, I sympathize with you, and I hope that you do feel better, and I hope that you do get taken care of. One thing I would say to you, though, that in your situation, right, the same people who don't want the quote-unquote illegal people to be here, they don't want you to get health care either. If you qualify for indigent help, you would be one of the people who is being denied. If you're in Texas, because you said you're calling from Fort Worth, you're one of the people who's being denied the Medicaid funding that's already been made available to you. So I think you're going to improve your situation better if you can fight to get those Medicaid funds made available rather than fighting against these other sick people who are in this waiting room with you who you believe are from some other country. Anyway, that's in terms of what will help you in the long run. If we make the Medicaid expansion available, that's going to get you out of that room faster than you trying to drive down the number of people from Mexico who are in the country.
I don't know. I disagree.
But think about it. Just think about it. That's $9.2 billion that's been allocated to take care of your health care needs. On the other hand, you can try to swoop up 10 million illegal immigrants and ship them back to Mexico and see if that improves your situation. See which of those things works first. And I guarantee you that expanding the Medicaid funds is going to get you better health care faster than going after the so-called legal immigrants.
I just don't see how in a down economy, how bringing more people to our country...
Well, statistically, more of them are not coming to the country. Did you know that the immigration from Mexico has stopped since the net immigration from Mexico has basically stopped since the Great Recession? There have not been large numbers of people coming in this country from the south of the border since that time because there were no jobs.
I don't know. Yeah,
But anyway,
see a lot of people going back to Mexico
But Sam, let me let you go because we got a couple other callers, and but I've enjoyed talking to you. And
look into the Medical Services for Indigents programs, because
I will.
Stuff on a local level where a nanny government doesn't need to be intervening in our lives.
But here's the contradiction. You yourself are asking for help and trying to take it from others. That's the only problem I have with what you're saying. You want to get help.
It was an option, though. It was an option.
Yeah, it's an option. It's an option for the other people too. But thank you.
Thank you, Sam.
So we're going to go to line 3 with Kathy.
Yes, good morning. Hi, Ken, and hi, Ken. Thanks for taking my call.
Good morning. Good morning.
I believe that I appreciate the comments that the previous caller made, but I have to vehemently disagree with what he has to say. And what's sad about that is I had a similar experience with what we just had with someone who seemed rational talking about the health care debate, and that's where our difficulty comes in solving the problems. That folks who have they appear to have the understanding of what's going on, and they reject that out of hand for some higher, or I should say, lower political ideology that really does no one any good. It would be so much more beneficial if we just cease and desist with all of the talking points, cease and desist with all of the, what you came to the table with all of these preconceived and most of the time misconceived notions, and then come up with some solutions like what you guys have put forth. That's so refreshing to hear you all meet with some of the kind of deranged talk with more rational talk that speaks to what we really can do as a country and what historically has been done in this country to move it forward. And then all of a sudden we find ourselves at a crossroads where folks really don't want progress, and they don't want people to succeed, and they don't want people to just have basic health care. That's inhumane to me. I just can't understand.
Hey, I'm with you, Kathy, and as I was trying to point out to the gentleman, he ironically was making it less likely that he himself would get health care if what he said he wanted to have happened. So it was, that's a little ironic. And, but there is a number of people who kind of have these kind of ideas where they actually want to vote against their own interests. But and that's unfortunate. But thanks again. Thanks for your call. We really appreciate it.
Thank you. You have a blessed day.
You too. Okay. One thing I want to reiterate: the rally against the TPP will be on Friday, January 31st at 12 p.m. That's Friday, January 31st at 12 p.m. It will be in Dallas, Texas at 2012 North Olive Street. That's near Clyde Warren Park. So, and that's being sponsored by Jobs with Justice and also supported by MoveOn.org. Okay.
Well, thank you.
Yes, our healthcare is one of our most serious things going forward. It's grown to about 17% of our economy, but we need to move forward with a policy that both embraces people morally, that it recognizes the idea that healthcare is a right, not just some kind of business operation. And that's also, ironically, is going to be the thing that's going to allow us to control costs. If we do the right thing, the costs will actually go down. And again, so this has been Ken Stevens, and I'm Kenneth Williams, and this was Workers Beat.
KNON 89.3 FM in Dallas and Fort Worth, the voice of the people.
Business owners, tell KNON's listeners about your business. You can put your business or event on KNON. KNON currently has space available to run announcements for you. Tell KNON's listeners about your goods, services, nightclub, concert, or event. Help keep the voice of the people on the air while putting your information on the air. KNON's been named the #1 radio station in Dallas by both the Dallas Observer and D Magazine. Put your business with Dallas's #1 station. Call now for more information at 214-828-9500, extension 227, or extension 233. For more information, go to KNON.org and click on the Run Spots on KNON page. It's a great way for your business to support community radio while letting more people know about you.